Frontotemporal dementia and ALS are actually two relatively rare neurodegenerative disorders. The first symptoms in frontotemporal dementia are usually changes in someone's personality or behavior. There can also be language problems, for example, word-finding difficulties. Typically, patients get these symptoms around the age of 60. In ALS, it can be at any age. It can be as early as 20. It can also be late in the 70s and 80s. But there, the initial symptoms are weakness of the arms and the legs, sometimes also problems with swallowing. In 2011, we found that a specific mutation in the C9orf72 gene is actually the most common genetic cause of both frontotemporal dementia and ALS. And this was the first genetic cause that actually was found for both of these diseases at the same time. And because it was also the most common one, we knew that it was going to be very important if we could understand what this mutation was doing. It really could impact a lot of patients in terms of a potential therapy. This particular mutation is really complex. It's doing multiple things. So on the one hand, it's producing toxic molecules in the brain. And at the same time, you also lose the normal function of the gene. And that together actually leads to disease in these patients. Does everyone with this mutation get the disease? We thought so initially, but now there have been some individuals identified that are 80 years old and are still healthy, which actually is good news because it means that some individuals might be protected from disease, potentially through other genetic factors or environmental factors. But for the most part, people will develop disease, either ALS, FTD, or actually both. Here at Mayo Clinic, for the past 15 years, researchers have continued to work on this discovery, trying to understand the mechanisms that could ultimately lead to a therapy, but also worked on biomarkers. Like what can we measure, for example, in patients' blood that could tell us who's at risk of developing this disease, and also once there is a therapy, is the therapy working? While there is no treatment at this moment for these diseases, there are many research studies ongoing, including here at Mayo Clinic, where patients and their families can participate in research. We can follow the disease through the early stages, trying to identify what are the first symptoms that individuals have. And this can really help us to, first of all, have better diagnosis in the future, but also to understand when we need to treat individuals as soon as we have these therapies available.